Okay, well, this is top 50 books of all time. We did part one was books 1 through 5. Today we're going to go through books 6 through 10. We're going to start with Walter Kempner. And Kempner is famous for pioneering the rice diet with incredible results. He's one of the greatest doctors who ever lived. He saw about 19,000 patients in Durham at Duke, North Carolina, back from about 1940 through about 1980. And rice is only 1% of calories from fat, so the lower the percentage of calories from fat, the faster people lose weight. And he was famous for having a bunch of patients. He wrote one study where he had 106 patients that lost over 100 pounds of weight. He was also famous initially for getting people who had kidney failure. There was no dialysis in those days, and he would keep them alive by putting them on a super low protein diet. Like if they needed more calories to gain weight, he would just give them table sugar because there's no amino acids, there's no nitrogen in that, and that way it makes life easier for the kidney. About 75% of what a kidney does is excrete nitrogen. He's also famous for having patients come down with systolics in the 200s, come down to normal blood pressure. And that was due to marked reduction of fat and marked reduction of sodium. And he talks about the threshold effect of getting sodium really low. He would have patients on like 150 milligrams a day of sodium. I just included this other book here as sort of a just for fun. I put some honorable mention books in here just for fun. This lady's name is Jean Anspaugh, and she was a patient, fat lady who went out there, and it's full of funny sayings and jokes about what it's like to be a Kempner patient. Down here on this first slide, it's from drmcdougall.com website, is the scientific publications of Dr. McDougall. One of them is in German, so that's hard for most people to read. The other one, though, is his papers. I'll actually show another picture from that. I've got other lectures on Dr. McDougall, on Dr. Kempner. Dr. McDougall's got lectures on him. Here's why he had public weigh-ins for his patients in the rice houses. They live in these like apartment buildings, and they'd all weigh in publicly. They could talk to each other. The ones who lost over 100 weights get their picture on the wall. They'd record their blood pressures and making it public. They'd put a little peer pressure on the people. So Kempner was fantastic about that. What was a little weak about Kempner? I don't think he taught the patients enough about why it works. And so some of them would have a tendency to get recurrent fat after they go home. So they need to be educated a little more, I think. But he had incredible results. He had all these patients who would reverse, for example, diabetic retinopathy. I've had my eye doctor friend tell me that 10 times more patients in his experience go blind from diabetes than from hypertension. But certainly hypertension causes a lot of visual problems. Here's a page of the table of contents from the Kempner book of his publication that's at drmcdougall.com. Treatment of kidney disease and hypertensive disease with the rice diet. The same title for the next one. Okay, same title for the next one. Additional insights on that. Compensation of kidney dysfunction and treatment with the rice diet. Okay, and there's a whole bunch of it. Treatment of the rice diet for hypertension. So I show you this because it's well worth reading. There's nothing like Kempner. It's so amazing. It almost sounds like a cartoon. It's all these patients being cured and healed. And Dr. McDougall had said, don't even talk to me about nutrition if you haven't read Kempner and Pritikin yet. You really should read that if you're serious about studying nutrition. I mean, just to make yourself healthy, you don't need to read all this stuff. You don't need to know all this stuff. Just eat the low fat, low sodium, 100% vegan, whole food diet with no oils, okay? No alcohol. No MJ, no tobacco. Just do that and you'll be way ahead of 99% of everybody else. But if you really want to learn a little bit more about the details of nutrition, it's well worth your time to read Kempner and Pritikin. Okay, here's some more stuff you'll see, just typical Kempner stuff. These patients with congestive heart failure and a dilated heart returning to normal. Some of that might be also because they're big fat belly, they're not taking a deep breath, artificially exaggerating the size of the heart. But it's also partly reversing congestive heart failure, which is rather extraordinary. There's other case reports of that out nowadays as well. And look at this patient's, blood glucose goes from 248 to 91. I'm assuming that's a fasting blood glucose. Their proteinuria in the kidneys resolves. Their kidney function's improving as well. Their blood pressure goes from systolics 200 over 130 to 130 over 86 in this case. And Kempner's got hundreds of cases like that. Okay, here is from a Dr. McDougall lecture. Like I said, he says, don't even talk to me about nutrition unless you've read Kempner and Pritikin. So I read through all of Kempner's work that I could get my hands on. Same thing with Pritikin. I read all three of his books. Here is, like I said, he would give white sugar just as a way to avoid giving him any nitrogen if patients were losing too much weight. And look at the numbers for the Kempner rice diet, 2% of calories from fat. That's extraordinary. Only 2% of calories from fat. I'll say it again. Only 2% of the calories from fat. With rice, you only have 1% of the calories from fat. So that's quite extraordinary. Only 4% of the calories from protein. That almost sounds a little too low because for white rice, the number of calories. I remember one of the guys, I think it was Frank Nealon, he said, oh, there's only 5% of the calories from protein in the white rice they were feeding to the patient. And I believe it was Uncle Ben's rice. The only reason, though, I would wonder about that is I've seen other, sites, a couple different papers that all say, oh, rice has 7 to 8.5%, white rice has 7 to 8.5% of calories from protein. So I'm not exactly sure, but it's in that ballpark, And Nealon, he'd probably know what he was talking about. He's a physician, a Yale guy who worked with Kempner for many years and then also taught the rice diet for many years. And he said the rice they were serving had 5% of its calories from protein. But again, most of what I've looked up at 7 or 8. That's still really, really low. Just for comparison, salmon, eating the fish, salmon has 50-50, 50% of calories from protein, 50% of the calories from fat. So 94% of the calories in the Kempner diet were from carbohydrate. So again, extraordinary. And he had incredible results. The best doctor of any doctor in the world I've ever seen. Only doctor who rivals him was McDougall. And I said McDougall's cured more patients through his books and his teleradiology, but it's both quite extraordinary. Oh, here's one picture of McDougall. Okay, I'm sorry. Kempner cured McDougall's lecture on Kempner. McDougall pointed out that Kempner cured 100% of his type 2 diabetics. 100% of type 2 diabetics. If you give a pill, the cure rate is 0. You match the ill to the pill, send the bill. You're never cured. They take the pill the rest of your life. To be cured means you don't got to take pills anymore. Okay, the next doctor's book I'm going to show you is Blood Viscosity by Gregory Sloop, the pathologist. And he's a great pioneer of atherothrombosis theory. And he did a whole bunch of stuff to figure it out. And like I said, too, the best experts of atherosclerosis are these pathologists because they just look at it under a microscope and they don't care what it is. And it turns out atherosclerosis is a blood clot. That's a super important insight. When you read articles about atherosclerosis by a vascular surgeon, they're usually going to emphasize their surgical procedure. By a cardiologist, they're going to emphasize stenting. Okay, if it's an internist, they're going to emphasize prescribing all these medicines. Whereas pathologist looks at it under a microscope and goes, hey, it's a blood clot. Anyways, these are bridging molecules that cause red blood cells to stick together. Red blood cells are also called erythrocytes. So LDL cholesterol in particular, that's why LDL cholesterol is associated with atherosclerosis. Total cholesterol is an indicator of what LDL cholesterol is going to be as well. So you can just go by total cholesterol. And the goal is to keep it below 150 based on the Framingham study, based on Caldwell-Esselson's data, and based on the work of other doctors. Okay, other things that will be bridging molecules. We talked about fibrinogen, the clotting protein. LDL cholesterol, uric acid will also do that. And also, if you got elevated bacterial endotoxins, LPS from gram-negative bacteria, LTA from gram-positive bacteria, and excess iron with iron overload and subsequent increased serum ferritin, when you get more free iron in the blood, that will also cause amyloidogenic clotting. So those bacterial endotoxins, LPS and LTA, will do it. I'll show you a picture of that later in this talk, but that's not widely known. And viral proteins can do that as well. But it's something that's strongly worth knowing. Dr. Sloop's got lecture videos online. His book is great. It's a great book about understanding atherosclerosis. I did a fellowship many years ago at Harvard in imaging-guided surgery with the emphasis on vascular disease. And I can tell you, all these big shot doctors at Harvard, I learned a ton of stuff there. It was really good for learning procedural skills. But nobody was talking about, accurate conceptions of what atherosclerosis was about. I never heard it was a blood clot until I read Sloop. And that's the most important thing you can know. And I can tell you, I look at atherosclerosis in many different ways. I look at it on catheter arteriograms, on MRA, magnetic resonance arteriograms, and most importantly on CT angiograms. And on CT angiograms, it's exactly the same as a blood clot. And Sloop, everything Sloop said comes true for all my imaging experience of looking at atherosclerosis and treating it. This is just an honorable mention book. It's written by Axel Haverich. I mention these honorable mention books for the aficionados who want to do extra reading. A regular person who just wants to get the basics, you don't need this book at all. But what I like about it is he talks about atherosclerosis in the vasa vasorum, and you can thrombose off the vasa vasorum, the outer vessels that supply the outermost layer of the big arteries, and that can damage and weaken the wall and contribute to aneurysm formation. And that's why the same risk factors for aneurysms are the same ones for atherosclerosis, and that's a big part of why. So that's kind of interesting. Okay, the next great book. So this is book, we went through those last ones where Kempner was number 6, Sloop was number 7. This will be number 8. The High Blood Pressure Solution by Richard Moore. It's a fantastic book. This is one of the most magnificent health books I've ever read. By the way, all these numbers, they're not in any order. I just put the first 5 were to kind of go through the introduction to nutrition, the McDougall School, give you the foundation to understand everything else. And now I'm kind of emphasizing atherosclerosis and hypertension. Okay, it's the best book ever written on hypertension. There's nothing even close. This is a masterpiece. This is a beautiful book. I can tell you I have internal medicine doctor friends who just love this book. They sit there and they read this book and then they read it over again. They read it over again. Do they want to understand it? It's beautiful. It just opens your eyes to what's really going on. So the key thing to understand is you have this plasma membrane, potassium, sodium, ATPase pump. And it's pumping out more sodium, 3 of them, and only bringing in 2 potassium. The net result is you're pumping out more positive charge. So your resting membrane potential, let's say in a neuron, is around negative 65 millivolts. And that's important. You got a negative charge inside the cell. That's an electrical gradient. And then because you're pumping more sodium out, you'll have a chemical gradient in terms of concentration. You'll have a lot more sodium outside the cell than inside the cell. And that's going to mean that sodium outside the cell wants to come in to equilibrate its concentration gradient. And because of the electric gradient as well, the negative charge inside, it's positively charged. It wants to come towards the negative charge. Anyways, this is essential stuff. And then this is how the cell makes electrical power. This is a battery to provide electrical power for the cell to do work. And it couples this movement of sodium to pumping other things out, like pumping out calcium. And that's the most important thing, to pump calcium out of the cell. Okay, then he talks about a K factor. Basically, what really matters is not so much your sodium intake as the ratio of potassium to sodium. And so you need potassium. It's a vasodilator. That and magnesium are vasodilators. They both come from plants. P for plants, P for potassium. And magnesium's in the center of chlorophyll. So these two counteract the effects of sodium. And you need to have at least 5 times more dietary potassium than sodium. All you got to do is eat plants and you'll have more than 5. I think our ancestors probably had about 25 to 1. I think my diet is probably about 20, 25 to 1 more potassium than sodium. Whereas the average American is more like 15 times more sodium than potassium. That's why they're hypertensive. Okay, now McDougall's going to say sodium's not that important, but he's talking about with changes within a narrow range. Let's say something between 6,000 milligrams per day of sodium versus 2,000. And what Kempner says, start getting it down below 1,000, around 500 and more, and you'll have a big threshold effect, and it has a profound effect on reducing hypertension. Okay, this is just a little bit more of a detailed slide showing that when calcium comes into the cell and is elevated in the cytoplasm, it activates the cell to do whatever it does. So it activates a vascular smooth muscle cell to contract and narrow the artery diameter, and that causes high blood pressure. And so you need to pump it out. How do you pump it out? Well, you need to have these gradients functioning well. If you eat too much sodium and not enough potassium, it dissipates this gradient, and you're not as effective at pumping calcium out of the cell. That's the sodium effect. The high fat effect was you stick your red blood cells together, and then you're pumping thick blood, a milkshake, up to your brain instead of pumping thin blood like water. So you need to pump at a higher pressure to pump it up. But trust me, it's an extraordinary book, and it just clarifies tons of vascular physiology to understand that. And it's not in any of the medical books. That's why, these internal medicine doctors, I know, some of these guys, anywhere from 10 to 35, 40 years of experience, and they're like, oh, this is so beautiful. They love that book. That book is like, it's like, oh my God, why didn't I learn this 10, 20, 30, 40 years ago? This is magnificent. That's how people feel when they read that book. It's magnificent. Okay, here's another fantastic book, Prevent and Revert Heart Disease by Caldwell Esselstyn. Now, Caldwell Esselstyn was like a cancer surgeon operating on breast cancer patients, thyroid cancer patients, and he did the best he could, and he was a very good doctor, one of the top doctors over at Cleveland Clinic, but he's a little frustrated because he felt he could do more. He started reading some of the epidemiology, became familiar with Dr. McDougall's work, and he's like, wow, all these people, illiterates in backward, rural countries all over the place, and they're healthy, and all these, so-called sophisticated, educated Americans, they're fat and sick. So just on his own time as a research project, he started putting patients on this low-fat vegan diet, and he got incredible results. Here's a landmark paper. It's from July 2014, the Journal of Family Practice, and this one was with 198 patients, and really high adherence to the diet, 89%. And I think that's because they sought him out. Regular patients, you can barely get them to even try the vegan diet, but patients who were desperate, they sought him out. 89% stuck to the diet for the duration of the study, which was about 4 years. And only 0.6% had a recurrent cardiovascular event. And he says it's because that one didn't follow the diet, but he felt it would be better to report it or people would not believe him. Okay, and here's just one picture of one of his patients. This was actually a physician who went on a strict vegan diet, really lowered his dietary fat intake. And this is a coronary artery cardiac cath. And you can see the artery is kind of ratty in here, and that's looking to me like about a 60% stenosis relative to the normal diameter adjacent. And the artery came back to normal. Don't get me wrong. Parts of atherosclerosis can be reversed. Parts of it are unlikely to be reversed. Like calcium typically is not going to be reversed. I know some people are going around on the internet saying you can reverse the calcium, but I'm just telling you, that's a rare thing. William Roberts, pathologist, says he's never seen it. I haven't seen it looking at my CT scans, but we don't keep imaging the patient. Some people report that they have seen it. It's not going to happen that fast, but you can certainly get the endothelium to start functioning better, making more nitric oxide quickly, and restore blood flow to a large degree just from that. Then you'll resorb the fat, the necrotic core, the lipid core, and you can get these plaques to shrink, and you get increased blood flow from that. And like I said, from the vasodilation, all the nitric oxide starts functioning again. Endothelial nitric oxide synthase and all the small penetrating arteries that go into the cardiac muscle, intramyocardial branches. Okay, and here's a reversal on a PET scan, positron emission tomography. So here you had a gap in the flow, and then here now it's coming back. Okay, so that's a wonderful thing. They used to think atherosclerosis was irreversible. I kind of joke about Esselstyn being like an Old Testament God, He says, no oil, not one drop. No nuts, not one bite. No meat, not one bite. Okay, and that's good that he says that, People have to know what to aspire to. If they don't want to do it, that's their choice, but at least let them know what to aspire to. Because a lot of people say, oh, a little bit of nuts, a little bit of seeds, a little bit of this or that. But in my experience, patients who say I'm cutting down, they don't do well. And, Esselstyn says moderation kills. These patients end up with crappy outcomes, a lot of them. Okay, here's just one other thing. Like I said, only 99.4% of the patients over 4 years, no recurrent events. And then people try to tell you the Mediterranean diet's a joke. It's a good diet. It's a joke compared to the Esselstyn diet. Esselstyn basically says the Mediterranean diet is a hoax. With an optimized version of the Mediterranean diet called the Lyon study, there was like a 25% recurrent cardiac event. Look at the Esselstyn study, less than 1%. So Esselstyn's more than 30 times better than the Lyon study. What more do you want? You want a 25% recurrent risk or a less than 1% recurrent risk? It's obvious this is best. Okay, the low-fat, low-sodium plant-based diet is the way to go. And you can imagine with more fat in the paleo-keto carnivore compared to this optimized Mediterranean diet, they're a joke, okay? They've never reversed coronary disease. Don't be fooled by that. Okay, the last book, this is number 10. And by the way, these books are not in order. They're just general, disease categories is how I'm presenting them. So this is book number 10. This is my book, The Medical Reformation, Vegan Renaissance Guide. And I kind of got that from Luther, show me the error in my books, I'll be the first to throw them in the fire. And Luther said a whole bunch of funny things. Luther was kind of crazy, but he was very entertaining, and he's a big hothead compared to most other Christian writers who are kind of boring. There's a couple other ones that are good, but, he was one of the most entertaining, and he was over the top, and he was kind of crazy. And I disagree with tons of things that he said, but nevertheless, he was interesting. Okay, so what's unique about this book? It's I've written a whole bunch of books before this, but what was unique about this one was I now had all the drawing tools available and I could illustrate them. So first of all, I make the point, like with Dante and Virgil, they say abandon hope above the gates of hell in Dante's Inferno. And that's what clinical medicine says to patients. Abandon hope. You can never be cured of these chronic diseases, diabetes, hypertension, obesity, coronary artery disease. But with the low-fat vegan diet, these are cured all the time. So the low-fat diet, it's better than conventional medicine for the treatment of the chronic diseases. And it's just full of pictures like this. This explains what causes leaky gut and how to prevent it. So that's why I think it was like my best medical book, because I illustrated everything. Here's amyloidogenic clotting. Here's, the amyloidogenic effect, not only of bacterial endotoxins, LPS and LTA, but also of excess free iron. Okay, so I illustrate all these concepts that are relatively difficult to understand without illustrations, and I go through all the bodily systems. And the book is big. I have a copy of it right here. You can see it, how thick it is, and it's full of illustrations, and it's basically the whole point of it was to correct the internal medicine textbooks. Internal medicine textbooks, they're all stupid. They're all a joke because they all say the same thing. Diets associated, diseases associated with aging. It's partly genetic. Sometimes it's an infection. Sometimes it's due to socioeconomic disparities. That's all bullshit. They're all always saying things that you can't do anything about, to tell you basically you're helpless, there's nothing you could do. Just take our pill and go for surgery eventually. Versus once you start learning nutrition and diet and lifestyle and how it all works, most diseases can be cured by this. No, don't get me wrong. There's some things you can't cure. It's also once the diseases become more chronic and damage the body, you're not going to be able to do anything, or you're not going to be able to fully reverse. You can partially reverse it, always improve it, but you won't completely cure it down the road, a lot of these diseases. But it's good to know what you can do to help yourself. And I go through, the entire body. I go through all the brain stuff, all the spine stuff, all the atherosclerosis, diabetes, hypertension, autoimmune disease, all this stuff. Here is, one of the things I do is I'm a neuroradiologist. I actually did half a fellowship in endovascular brain surgery as well, but I got a lot of experience with stuff in the brain. And so I explain all the stuff about what causes dementia, what you can do to avoid that, what causes a stroke, what are the issues of rehab and traumatic brain injury. So, that was my intention, to rewrite all the internal medicine textbooks. They all stink. And the internal medicine subspecialty fellowships, they all stink. I own the neurology ones from the Ivy League, 700 pages long, and they're a joke, okay? They don't even answer the basic questions. So that's why I did it. I had more time sitting around my house, and I said, I'm going to rewrite all these books, and that's what I did. So if you really want to learn, there's the answer. Like, here's a typical thing. I'm reading about, what causes diabetes and dietary fat inhibiting complex 3, right in this coenzyme Q complex 3 area. And I'm like, gee, there has to be more mitochondria inhibitors. I go through 7 of my own biochemistry textbooks that I own, and they don't answer the question at all. So then I go through the literature, and I quickly find over 50 mitochondrial inhibitors. You need to know this. How are you going to be healthy? One of the ways you get healthy is you avoid everything on this list. You avoid atrazine, so you don't eat GMO corn sprayed with that stuff. You avoid glyphosate, so you don't eat GMO soy sprayed with that stuff, okay? Watch out for statins. They inhibit intermitochondrial membrane at the level of coenzyme Q. Now, does that sound like a good idea, to be inhibiting your mitochondria? I don't think so. Is that why statin therapy is associated with increased risk of diabetes? Hello. Okay. Statin for cholesterol. Excuse me. Here's metformin, one of the most common medicines used to treat diabetes. It's a mitochondrial inhibitor. Great. How stupid is that? Here's processed food. They put mold inhibitors in there. Mold inhibitors are antifungals. Many of them are mitochondria inhibitors. Tons of common things are mitochondria inhibitors. They put kids on antibiotics for a long time, sometimes for years, for acne. They're mitochondria inhibitors, okay? A lot of them. These like tetracyclines, please. Okay, it goes on and on, all right? So what I'm trying to say is my book goes through all that stuff, and I go through toxicology. And like I said, that's one of the things that makes me unpopular. Here's my theory of the supply and demand theory of neurodegeneration. You just avoid all these things, and your risk of dementia is markedly reduced. And it pisses me off too that, like I said, I talk to all my neuroradiology colleagues, neurologists, spinal cord doctors, internal medicine doctors. They're like, yeah, Pete, you're absolutely right. This makes sense. This is what we should all be focusing on. Then I'll submit an article to the journal. They won't publish it because there's no money in this. Do you think they want this diet and lifestyle stuff in there instead of selling their drugs and surgical devices? No. Okay, so if you answer a micro question, they're like, oh, isn't that wonderful? But if you change the paradigm, they're pissed off because they could lose money on that. So they won't give you space in the journals. The journals are owned by big business, okay? So that would piss me off. And then also conventional doctors, they're not going to have you say anything that's not in their textbooks. That makes them nervous. There's no money in that. They're afraid they'll piss off their higher ups, in the billing game, money-making system. So most of them won't interview. They'll personally tell me to my face all kinds of nice things. Pete, you're a genius. Pete, you figured this out. Pete, we should all be doing this. But then they'll come and say that to me personally, but then they won't invite me to speak in front of their groups. So that's why I'm on the internet, making videos on the internet, and that's why I write these books. So anyways, there it is. If you want to learn, it's there. Okay, and so that's the end of books 6 through 10 for the lecture today. I hope that was helpful.